the issue of the need for transparency, especially with regard to procurement in our country. We have focused heavily on some of the issues that have been raised with regard to procurement in KEMSA and others. But I think this, as indeed was said by some of the speakers earlier, is not an issue that is related just to the health sector, but indeed to all government procurement. At the national level, at the county level, in the judiciary, in the National Assembly and Parliament, we need to work together because we have the laws. What we need to have are the systems. And again, towards that end, I also hereby direct that the Ministry of Health, within the next 30 days, must come up with a transparent, open method and mechanism through which all tenders and procurement done by KEMSA are available online so that we can see who has been awarded a tender, we can see what is the value of that tender, we can see what was that tender for, we can see as they proceed, how was that tender evaluated, we can see how have people bid, we can see who was finally awarded. I think this level of transparency and through the use of technology will go a very long way towards ensuring that we have the confidence of our people, that those who are placed in institutions are able to manage the resources of the Kenyan taxpayer plus our development partners in an open and transparent manner. And I think this, as we start with the Ministry of Health, is something that we must move into all government departments, like I said, be they in the national government, the county government, or for that matter, in the various other arms of government. The Kenyan people have a right to know how their funds are being utilized. The other issue that I think has come out very strongly in this conference is the need for us to once again refocus on mental health care. We have seen that this is becoming an increasing problem, as I have mentioned in the past, an increasing problem in our country, amongst our people, especially our young people. There is really a need for us to refocus our efforts and redouble the work that we're doing to help and to work with the mental health of our people. And towards this end, I really want to say that it is not just the relatives or the health workers, but it is the population at large. I mean, there has been a huge impact as a result of the lockdown that we have had on our young people who have felt restrained and constrained from the liberties that they know. And this has seriously affected the health and well-being of our young people. So I think that there is need for this, and there is need for a focus on this. And towards that end, without even waiting for the national conference, I do hereby direct the Ministry of Health to begin working on an active plan that they can present to us when we have our national conference on how we are going to deal with the issue of the mental health and mental well-being of our people. Without a doubt, we need as a country to re-engineer ourselves and to really focus on preventative healthcare. Not just wait for things to get to a critical stage, but to prevent them before they actually happen. This must be the focus, and this must be the base of our universal health care going forward. I think, governors, you will agree with me that as a result of some of the measures that we have taken during this particular COVID pandemic, we have seen a massive decline in waterborne diseases and the problems that have affected our people in the past as a result of cholera, bilharzia, and other waterborne diseases, all these issues related to cleanliness, we have seen a huge reduction in the number of cases that are being reported in our respective hospitals as a result of the actions that we have taken on COVID.